Good afternoon, everyone, and apologies for the interruption. The Wi-Fi needed to be reset or improved or something. Anyway, let's get started. So as I was starting to say in the first question that we have received from the community is the SEC statement around what is a utility token and what is a security token. We have always anticipated that our token needs to be compliant. And we've always taken the steps that we should be transparent in the way we conduct the token sale, the way we conduct our business, the way we communicate to the token holders. And our vision has always been that the laws, regulations will change. And all the regulations that we think may apply to us, we should presume that they already apply to us, and then conduct ourselves accordingly. So nothing really new happens with this announcement other than we feel vindicated that our caution and our tremendous amount of work we did during, before, and after the sale, both in terms of the product design, the product launch planning, signing the real clients, and conducting the token sale in a way that would pass an appropriate review and audit by a third party. All those things put us in a very good position. We cannot predict the future in terms of what else will be said or done in terms of regulation. But what we can predict is that we would have found to be very compliant and diligent should somebody audit us. So in that regard, I'm not concerned. I feel that all the hard work we put in beforehand protects the company, protects the token holders, protects our clients, protects our global community. And we should continue to march forward with the same measure of focus and caution that we've always used. So in short, these developments around tokens and their nature, utility versus not utility, these are all necessary evolutions of the market to mature it, to bring it to a global business community. And the more clarity we have from the regulators, the better. And we will adapt if necessary, and we'll continue to use our best judgment to protect the company by making good decisions. So with that, let's move to the second question, which is when will the app be in the App Store? So there are two releases for the Care Wallet. The Provider Care Wallet is being set, the timeline for the release of the Care Wallet for providers in the App Store is determined by our client, Arizona Care Network. And my understanding is that they are in the third or fourth round of testing with providers. And we should be releasing that in the month of June, but the date will be set by Arizona Care Network, not us. But I expect it will be before July 1st. The date that is in our control is the Consumer Care Wallet. And we have set a date for that for July 23rd. And that wallet is for everyone, for you, for me, for every single family member, every friend, and every colleague that we know. And the Care Wallet for consumers is a globally available application that allows you to use certain defined care cards that we will publish right at the point of launch. And then additional care cards will be released in perpetuity. In other words, I expect to see, and I'm working on ensuring that we have dozens, if not hundreds of care cards for you all to choose from and download into the Care Wallet to manage your healthcare in terms of scheduling an appointment, finding a specialist, comparing the cost of prescription, taking your prescription on a timely basis, communicating post-surgery complications to your physician, or proving the insurance eligibility of your healthcare plan, and on and on and on. There are literally hundreds of use cases that we are looking at in the form of care cards. So to summarize, the Provider Care Wallet should go live this month, and the Consumer Care Wallet will go live third week of July. The next question that we were asked, number 3, is can we already use our tokens once the platform is online and the app available? The answer is, of course, yes, absolutely. That is the point. Every one of you who has a CAN token, your objective is to download the Care Wallet and use the Care Wallet. And if you use a free care card, then you don't necessarily need to spend your CAN token. But if you use a paid care card, then of course you will need to spend the CAN token. Regardless of whether you use the Care Wallet for purpose A or purpose B, paid or free, you still can transfer your CAN tokens between your ICO wallet and Care wallet, so that all the tokens that you purchase during token sale can be automatically loaded into your Care wallet for the effective use of healthcare related use cases by you and your family and your extended members of the family. So we encourage you all to use the Care wallet, to download it, to share it with other members in your network, personal and professional, and encourage them all to get used to using the Care wallet as a means to really improve healthcare for themselves and for their families and for their employees and for their coworkers and so on. So the Care wallet application very much runs on CAN tokens, and having a CAN token is the primary way you can fully harness the power of the Care wallet. The next question we have is about token swap. So let me actually talk about what is token swap for some of you who may not be fully aware of the status. As part of our recent audit and part of our internal review and the board calls, and also discussions with outside advisors, we have decided to rename the CAN token, which means that instead of it being called a Care Administration Network token, it will have a new name. It will remain precisely the same token with all the same rights. It in fact inherits all the rights of the CAN token. So in effect, it's a renaming. But in the blockchain world, renaming is essentially a swap. Since tokens cannot be really renamed, they are immutable on the chain, we are essentially swapping the CAN token for the new token. And that swapping process will be done through your ICO wallet. Each one of you who has a CAN token today, you have it in the form of your ICO wallet. ICO.Solve.Care is where you have your wallet, and that's where you log in, and that's where you see your tokens. Those tokens will be swapped within that wallet. So you will have a swap button, which will allow you to read the terms and conditions of the swap, make sure that your balance in your wallet is absolutely and 100% accurate, and that you have every token that you expect and deserve to have. And then you will, once you have verified the balance, you will simply click on the swap button, and your CAN tokens will be sent to a burning wallet, and your Solve tokens will be placed in lieu of that in your wallet. So you will have a one-to-one swap, and it should be as simple as clicking on the swap button. Therefore, the process is simple, but we really want to make sure that every single adjustment, every single bonus token has been placed in the wallets before we do the swap. So we are working right now on the final round of adjustments and transactional activity that needs to be done before the everybody's wallet balance is absolutely accurate. And once that's done, your swap button will give you the ability to do a flip. And we want to make sure that every token is accounted for, both in terms of the tokens being replaced and the tokens that are replacing the tokens. So that process will begin, and the roadmap has been published. And I believe the token swapping period begins on June 25th, in about 3-4 days. And you will have 2 weeks to go through your wallet, make sure that you check your balance, and then you swap all the tokens. The process of swapping is being done behind the scenes by our technology team in conjunction with our platform team. So they are working on ensuring that the swap process is properly set up and works flawlessly. So you click on it and that's all you need to do. So we want to be cautious and ensure that there will not be any hiccups, given that there'll be thousands of wallet holders who will be looking to swap their tokens. So we want to give you enough time to do it, and we want to make sure that it's easy to do. So stand by for more announcements on that from the marketing team and from the CTO. But I like the plan that was presented. I like the approach. It's conservative, it's cautious, and it's easy. So we will get that token swap done fairly soon. The next question that has been asked is, when will the Care Card user experience competition start? So that's a really exciting journey in terms of developing our care community and a step towards a care marketplace and a step towards a more useful care wallet. So we are really excited about launching the care card user experience. Let me talk about the contest a little bit, because I think it's really important for you to know why we're doing this. So the vision behind this contest is to create a delightful user experience, to think differently about how we interact with the care wallet. How does the card really make my life easier, not more difficult? And the way I like to tell my team is, I'm leaving from the gym, and as I walk out of the gym, I get an email or I get a message on my care wallet saying that my son's pediatric appointment for next Tuesday has been canceled because a pediatrician is not available. And before I get to my car door from the gym door, I want to be able to reschedule him. I want to be able to figure out when the physician or pediatrician is available. Maybe I need to change the pediatrician. Maybe I need to reschedule to the next available time. Maybe I need to take my time off from work. Whatever I have to do, I need to be able to do that in the next 15 seconds as I'm walking from one door to the other. And I need this to happen accurately, timely, without stress. So maybe my hands are full and I only have one hand free and I'm carrying my gym bag in the other hand. The care wallet must let me do everything I need to do to reschedule this appointment within the next 15 seconds with one hand in operation. That's a delightful user experience. It doesn't exist in healthcare. No such thing. So from that point of view, that's the vision. To create that usability, that remarkable experience that makes the care wallet user go, wow, I never thought life could be this easy. It's as good or better than Amazon buying experience. That's what we want. And to do that, we're going to challenge a global community of Solve.Care to come together and present to us ideas on how care card should work in a completely different way. If you're going to show appointments, let's not show another calendar. Every calendar looks the same. So let's not put another calendar on the care card. Let's imagine a different way to show my appointments to me. If you're going to ask questions about what type of physician you're looking for and when you can go see them and what's your preferred time, let's not present a bunch of buttons and expect me to essentially do in an iPhone like every other very uninspired user experience looks like. So what we are asking for the global community to do is to think outside the box, way outside the box, and come to us with care card designs that will make my mom, who is 70, or my daughter, who is 10, to be able to do this and not ask me questions like, Dad, how does it work? They should be able to do it intuitively themselves, whatever it is that the care card allows them to do. That delightful, intuitive, predictive, anticipatory experience is what we are looking for. So we have put out a lot of incentives for people who will come in and design care cards to think outside the box. And the grand prize is 100,000 CAN tokens for each of the 3 care cards that we are launching the contest around. So, and the goal for that is that there is real incentive for people to really put in the thought and the effort to design a unique user experience. I want you all to think like Steve Jobs and think how to break the mold, not to be in the mold. And with that kind of an experience design, we will create the kind of global experience, global adoption we want. Another thing that I say all the time is, whether I live in Indonesia or Indiana, I deserve to have a really easy to understand user experience that I can relate to. This is not about just a certain type of user. We want a global appeal. So we've done a lot of work in designing the template of the care card with a structure around edges and corners and 2 sides, and how the card must be single purpose and very well thought out, and so on. Those guidelines will be published to all the designers. But from then on, it's the designer's job to come up with the best possible design. So with all that background, we are very excited to launch the care card contest. It's a user experience contest. We're not talking about building the card in its totality today. We are talking about rethinking how you and I can humanize the user experience of accessing healthcare. And that humanity is what we are after. So therefore, the team has designed a special purpose website for the CareCard user experience. And that website will launch tomorrow, where all of you will be able to register as participants. We have put together a great jury that consists of some of the really good domain experts, some people that we know that are really pushing the envelope in innovation in healthcare. I'm very excited to have a gentleman, Subha, join our jury whose entire job is to look, he's a futurist, a healthcare futurist who thinks about how healthcare will be and should be in the future. So we have some great names on the jury who will take a look at these cards and choose the winners. We as a company, Solve.Care, will not participate in the selection of the winners. We want the jury to be impartial. We will do an initial screening to make sure that all the cards are appropriate. There is nothing inappropriate in terms of content, and there is nothing irrelevant in terms of requirements. So once we've done the appropriateness and the relevance of the card, we will hand over those cards to our jury to look at and choose the best first, second, and third place for each of those 3 cards. And we will be very excited to announce the winners on July 31st. All of that detail is coming on the website that will launch tomorrow. If you have any questions, certainly reach out to us or to Maria at Solve.Care, and we will look forward to your response. Now, the last thing I will say is this. This is the first CareCard contest. This is not the last. If what we learn from this contest, we will use in the next one and the next one. But I have a list of, I think, 17 cards I've given to marketing that I want to see user experience designed around. And there probably will be another 17 by the time we're done with the first. And those care cards define our go-to-market strategy. And we need a really unique way to design the user experience. So that's all about CareCard contest at a high level. There is a lot more to come in terms of announcements and website and the registration process. Please look out for that. You should have it tomorrow. Let's move to the next one. How is the recruiting going, and what type of skill sets are you looking for? Now, I did answer this question last week in the Telegram AMA. So I will summarize this today, maybe in a different way. You certainly are welcome to go look at the Telegram session I did last week. But as far as how's the recruiting going? So in some ways, recruiting is going really well. We have a robust recruiting team in-house of about 6 people. And we are expanding the recruiting team itself to about 8 or 9 people. But there is a lot of recruiting to be done. But at the same time, we already have a fairly decent and robust team, over 50 people and growing on a daily basis. And then we have external partnerships that are developing, which I'll talk about later. So as a result, the recruiting is a big focus, but it is not it's not a critical path item. We just need to keep making a recruiting process work better. So we recruit globally. Our goal is not to recruit in a single location. We are willing to bring in talent from anywhere, but we do tend to recruit for local presence in the office. We're not working with a lot of remote people who work remotely. No matter where you're located, if you belong in the Solve.Care team, we will make every effort to bring you here into the location where your work function takes place, Kiev or Estonia or the US or Canada in the near future. But it is a team that sits together, works together, plays together. We are not keen on being virtualized to a point where people don't work together and cannot get in a room together and discuss things. Maybe in the future, but today, the speed at which we want to move, and we are moving, the team needs to be in the same room. But that being said, we are recruiting in the US, we are recruiting in Ukraine, we are recruiting in Eastern Europe, we are recruiting all over Europe, depending on the position. For instance, we are currently looking for a development manager for one of our development areas, and we are recruiting as far afield as Germany and Sweden and Switzerland with experienced managers who would be interested in relocating to our Kiev office. So I will take this opportunity to say that if you are aware of talented developers, development managers, team leaders, quality assurance engineers, project managers that bring the kind of depth and maturity that a global company should have, and it is something in their career path to be part of our team, and if they qualify, we would love to hear from you. So feel free to give us recommendations and feel free to give us referrals. But we are very excited about the fact that the company is maturing and growing into an organization that I can feel proud of. And we already are proud of what we have accomplished. But I think as I look ahead and the type of clients we are going to serve, their expectations are going to be that of excellence. There is no room for error. There is no room for compromise when it comes to delivery or support or product quality. And for that, we will need continue to attract the best of the best. So again, recruiting is a constant vigil, constant goal, constant project. But we are happy with what we have done. We have a strong brand and a strong, attractive environment to work in, and we will make it better. The next one is when will the consumer care wallet be launched? I've addressed that earlier, so it's third week of July. The next question will be, will the consumer care wallet be available for download from the App Store? Yes. Google Play Store and Apple App Store are both required for the launch. Sometimes we launch one before the other, depending upon some logistics of approval process. But generally speaking, yes, the App Store and the Play Store will contain Care Wallet for both physicians and consumers. How is the small-scale testing coming along with ACN? Very well. I spent a few days in Arizona week before last. Met with the management team, sat with the CEO and the COO and their entire leadership team in their boardroom. And what I heard was very nice to hear. They were very pleased with the team, our team's responsiveness, willingness to listen, adjust, and appropriately enhance the wallet. Dr. Hannekam went as far as saying that he felt that we had met the obligations of our deliverable a month in advance of the deadline, which is very nice to hear, although we still believe there's a work to be done and we are doing it. But the fact that the client is seeing us exceed our milestones is very positive. That's always a good feeling when you can sit and let your client tell you how great the team is instead of me having to tell them that. So overall, we're doing very well. The testing process is taking longer. I'm not surprised. It was very aggressive, and physicians are busy people, and having them test the wallet and give feedback, then test it again, then give feedback is a process that's taken more cycles than we thought. But at the same time, we should have expected that because physicians are, as expected, very busy. But we are not beyond our milestone. We're just not as fast as we had hoped. Long story short, we'll still release the wallet in June as planned. Our deadline was July 1, and I think we will beat it. What is the plan for creating more buzz in the next few weeks ahead of token release? So this is a question that our marketing head, Maria, talks about a lot, and there are a number of things that she is planning to do. I will summarize them. There is certainly an effort underway to increase the amount of advertising that we are doing through the traditional means, social media and Google AdWords and so on, but not around the ICO token sale, but really around the product, the use cases, partnerships, and other things. The second is around some community management and expansion of our community outside the English-speaking universe. So we are looking to expand and actively manage our community in Korea and Japan as a next focus. So we have a great community management team that handles the primary Solve.Care community in English, but we need to expand that. So that's happening. There is discussions and partnership dialogue happening in terms of marketing. We are looking at additional marketing resources and marketing partnerships around public relations in particular, getting some articles published, getting major media covering us. There are a lot of events that I'm scheduled to speak at, starting with the one in Tokyo in about 2 weeks, and then the big event in Washington, D.C. around blockchain and healthcare. We just spoke at the French embassy. We just presented to one of the major pharmaceutical in their headquarters in Germany. We are mixing client-side, client-specific events with larger community events and industry events. So a lot more time is being spent. And the best part is that I'm not the only one on the road now. We have Irina and Julia, who just returned from New York, having presented Solve.Care at a healthcare on blockchain conference, which was very useful for us, both in terms of PR, brand building, as well as prospects and leads. So, marketing is never a it's not one-dimensional strategy. You got to do everything, and you got to do everything well. And just throwing money at something doesn't make it good. You got to do it well and then use the money needed to get it done. So I continue to challenge marketing team to expand and refocus on the brand and the product of the company. And it is something that they have done. They've pivoted from ICO on the element. And I'm very pleased with the brand recognition of Solve.Care in the healthcare industry. I cannot go anywhere to a healthcare forum, a healthcare conference, nor do I want to. They may not know what we do, but they certainly know that we are doing something on blockchain for healthcare. Now we got to teach them exactly what we do. It's not just about something cool and unique. It's about enrollment, eligibility, payment, adjudication, authorization, referral, pre-authorization, and prescription management. And what's really funny for me is that I'll go to these conferences and you will have the big consulting houses stand on stage and talk about the fact that one really needs some compelling use cases in healthcare. We gotta find some great use cases in healthcare. Otherwise, what is the use of blockchain in healthcare? And I almost want to stand up and every time say, but come to our website. There are 42 use cases listed, or read our white paper, or talk to us, because you're talking about coming up with use cases and we're talking about implementing use cases. And we have far too many use cases and we cannot implement them all in one day. So it's a real gap building between Solve.Care's vision, understanding, and applicability of health, blockchain and healthcare, and what we are hearing the consultants speak about. Wouldn't it be great if there was a great healthcare use case other than electronic medical records on the chain? And the answer is yes, and yes, they exist, and yes, they are relevant, and yes, our clients already love them, and yes, we are building them, and yes, they'll be out in the market before you stop writing your analysis on how blockchain can work in healthcare. So I'm happy that there is so much noise around use cases, and I'm really happy that we have gotten well past that point. We never were at that point for many years now, that how to use blockchain in healthcare. And our use cases, most importantly, are relevant and exciting to our clients. I don't go to client meetings and say, how would you like to apply blockchain in healthcare? I don't do that. None of my team does. We go there and say, here are 6 use cases that are relevant to you, Mr. Insurer. Here are 8 use cases that are relevant to you, Mr. Clinician or hospital administrator. And here is what they can do for you today, tomorrow, and 3 months. We're not talking about, let's start doing a consulting arrangement and figure out how blockchain will be used in healthcare, maybe possibly in 1 year from now. So overall, I think we are very happy with our focus on use cases, our unrelenting investment in building these cards as use cases. And frankly, I don't have time for a lot of the hand-wringing and noise that is in the industry. We are too busy implementing to worry about the noise and the drama around how will healthcare benefit from blockchain. The answer is, come talk to us. We'll show you 10 different ways that blockchain helps healthcare be better. There is a question about, are we planning for crypto marketing influencers and YouTubers? So the answer is yes. The strategy is the mechanism for marketing, both in terms of the crypto space, as well as influencers in the crypto space and the non-crypto space, healthcare influencers, people like Subha, people like Mike Kessel. These are people we absolutely will and are talking to regularly. And then there is definitely an element of putting more content out there to the form of YouTube and PR media conversations, articles, blogs that explain to people why Solve.Care is relevant today, not in the future, and why they should take us seriously and why they need to talk to us immediately. So the goal of this is to drive real utilization and adoption of the Care Wallet, and to drive real interest in massive number of Care Wallets being released in the market. And that drives everything else, right? I don't need to tell you all that the more Care Wallets are in the market, the more powerful is the CAN economy. It's that simple. And that's what we are focused on, maximizing the number of Care Wallets in the market in the next 12, 24, and 36 months. How do you send your CAN tokens to the Care Wallet? So there is the release of the Care Wallet allows for, from the asset card, the ability to move CAN tokens between your ICO wallet and your Care Wallet. It's that simple. You can put CAN tokens from your Care Wallet into your ICO wallet, which is essentially a Ethereum wallet, or you can move them from your ICO wallet to your Care Wallet. Following that, we will have a release that will allow us to move CAN tokens between the Care wallet and any Ethereum wallet other than the ICO wallet. But today, the first launch will be, if you have, and all of you do, have an ICO.Solve.Care, you will be able to use that contents of that wallet to move back and forth to the Care wallet. So it'll be basically a very seamless operation within the asset management card, which is a standard feature of your Care wallet. And we'll keep adding more functionality to this card. Next question from Crypto Batman. Is there been any interest outside US? Has the beta application shown to AC and demonstrated to any other client inside or outside US? So the answer is, that's a great question first. Let's talk about the interest. So currently, our pipeline is remarkable. I'm very pleased with it, and we will continue to make it bigger. But our pipeline spans multiple continents and countries. So first is US. Obviously, we have US significant presence in the US and growing. So that's great. We also have interest and real pipeline opportunities in Canada. We have real pipeline opportunities in the Middle East, in number of countries. We just started to expand our offerings into Africa through some partners and through middlemen. We are looking at expanding into Asia, Korea, Japan, and the Far East through partners again. Remember that our strategy is that we're not going to go in a Solve.Care alone. Every new country we break open, it is through partnerships and through intermediaries who have some domain expertise, some domain presence in insurance and healthcare. So clinical, financial, or administrative. If you have expertise in any of these three areas, if you either have clinical delivery organization, you administer healthcare or the benefits, or you're responsible for paying for healthcare or benefits, any of those three legs, we will talk to you and see what your use cases are that you can bring into your domain and your geography, country or continent for that matter. So there are definitely interest coming from multiple countries, multiple continents. And the question isn't, can we go global? The question is, at what speed do we want to go global? So we don't lose control over quality and the ability to deliver. But we signed recently a partnership agreement with a company that will take us into the federal government in Washington, D.C., which is making very good progress, and I'm very pleased with it. We are signing another agreement with a reseller that will take us into the state government market in the US. We are exploring a partnership with a company that is partially not-for-profit, working in Northern Africa, looking at a lot of opportunities in improving healthcare there using our platform. We have interest from India. We have interest from China. We just have to make sure that we find and choose credible partners. Our reputation is in many ways reflective of the kind of partner we have. So will we be global? Absolutely. Are we beyond the US already? Absolutely. But for us to go into South America, for us to go into smaller countries with large populations, but perhaps a more difficult healthcare environment, we want local partners. And that's what we are focused on. So to that effect, we are actively looking for partnership managers that have the experience in building partnerships that actually are beyond the paper, right? Most of the partnerships that are signed on paper and press releases are done never produce any value. I'm very focused on finding partners that actually will take the Care wallet and go to market in 90 days after signing the partnership agreement, not just sign it on paper and forget about it. So that's what we are doing. So look, I've been through a lot of this many times before, and I don't want to just create fake activity. I want to make sure that activity produces results. And the only result I care about is more Care wallets in the market. So if the partnership doesn't release Care wallets in the market, it's not partnership for us. It's just paper with a signature that yields no value to anyone. So that's why it's really important to stay focused and choose your partners wisely and choose your opportunities wisely. Why ICO is the next question. I'm sorry, I missed the second part of Crypto Batman's question. Has the application been shown to ACN? So we practically do a demo every day. Sometimes a demo is 3 a.m. because of time difference, but there is so many client demos happening. I'm really thrilled. Sometimes we show them the ACN use cases, the care cards for provider rewards, if they are a clinical or a provider-centric organization. But most of the time, we are actually showing consumer care cards, eligibility, referral, enrollment, medical transportation, on and on and on. So we have a number of care cards that are implemented either as a consumer to provider or consumer to insurer use cases. And those are the cards that draw the most interest from our clients. Even if they're a clinical organization, they want to see the consumer experience first. So we have done numerous demos, and we will continue to do more and more demos. We've gotten to the point where we have created a dedicated sales support team that does nothing but support the client-specific presentations and demos because the volume is so high, which is a great problem to have. If you don't have anybody calling you or knocking on your door, then you're building something that you hope somebody will buy. But if you have people demanding to see 16 demos a week, then you know you're on the right track. Why ICO? This question has been asked of me many times. I've answered this for the last 1 year repeatedly. I think the ICO brings the 3 C's together like nothing else does: community, client, and capital. And what I mean by that is we want to build a company that's based on the strength of the care community. I cannot build every care card, nor do I want to build every care card in every language on this planet, but we should, and the community will do that. We need to make sure the community has reward system baked into the model, so they will do it for financial reward, not just for altruism, which is why the CAN token becomes such a powerful tool for global adoption. That's how we're going to create a network effect. And then there is the clients. Our clients want to see that we have a long-term and a short-term vision. We have a clear roadmap, and we have a plan to be a global company, and that we're not going to be suddenly and abruptly acquired and shut down or bought in and digested by some other company. We want to be independent, and the ICO gives us that independence and the long runway. And the third was about the capital. ICOs to me are really another form of crowdfunding. Challenging as it is, the best way to see a token sale is to do a very compliant crowdfunding type of a sale, and that's what we did. So the capital that we raised through the ICO came with the right community behind it, came with the right expectations behind it, and that's what we wanted. We could have probably done a much bigger ICO and sacrificed some of those principles, but we weren't willing to do that. We want the right balance of community, client, and capital. And while not every ICO does it our way, we did it just to achieve that perfect balance. Would I have done it differently now that I know what I know? Not a lot. Most everything we did, I believe we would do again. Perhaps with less friction and less effort and less pain, but that's just experience. But I think we did it right, and we did it for the right reasons. Any plans for India? Absolutely. We are in dialogue with a couple of large Indian conglomerates that are interested in bringing our platform into either their conglomerate, which is a clinical delivery organization with a lot of hospitals, or and the second one is more from a reseller and deployment perspective. We have not signed a definitive agreement with either one of them, but it is definitely an interest for us and for them. Frankly, we haven't had the cycles to focus on India recently. We've been very busy, and we are still building out a business development and partnership management team. But India is a large population with some significant opportunities to improve healthcare. Near and dear to my heart is diabetes management for children and for elderly people, which sometimes people suffer from lack of proper and timely care and timely information. We can fix both of those. So India, China, all the East, where adoption of the best practices from the Western world contextualized for their market can be so powerful, both economically and socially. We must do that, but we must do it the right way. So do I see us barging into India tomorrow? No. But do I see us having meaningful partnership in place by end of the year? Absolutely. When am I going to take some rest? You deserve a vacation. I will take some rest in July. I wanted to get us to a point where all our pipeline is well managed, and we are, as I said, hiring a lot of people. I want to train them, put them in place, but I do have a week off in July, between first and second week of July. And I promised my family that I will really, truly spend the time with them and not be on the phone or not be doing a midnight phone call with a client. So if I disappear for about 10 days in July, don't worry, I'll be back and refreshed and ready. Thank you, Sean, for the comment about the confidence we inspire. I think the strength of the company is very much the team. And we have taken maybe not the easiest path to build this company. We've taken the most conservative path. But in the end, you can act in haste and repent at leisure, or you can do it right. So we see a global opportunity. We see our mission and passion is driving us to build something very sustainable. And I've said this before, and I said this in Netherlands last 10 days ago on TV interview. They asked me, what is my personal goal? And I said to them, my personal goal is to turn over this company to the next generation of managers, people who are part of this growth, who will ultimately run this company one day. I want this company to continue to grow and prosper long after I have left or retired. But the goal here is to make Solve.Care independent, strong, and long-lasting, right? So with that in mind, we better put the foundation in place today and do it right, because you don't get to put the foundation in twice. Somebody suggesting we do a small second ICO to give me a vacation. That's a scary idea. A second ICO will consume me for another 3 months. But interestingly, on that point, we have at least one partner, possibly two, who are looking at the Solve.Care platform and saying, wait, I can build my use cases on your platform and do my own ICO with Solve.Care providing me all the underpinning. And that makes a lot of sense. We are exploring this because there are so many great ideas in healthcare. And some of these ideas we will implement through the community as care card. But it makes total sense for somebody to say, I have a brilliant idea that I want to implement, and care card in the ecosystem of Care Wallet is the right vehicle to do it. So you, Solve.Care, give me the platform, let me build my own care cards, and I'll go do my own ICO. If they're credible, if they convince us that this is a name and a focus and a goal and a mission that we can associate ourselves with, we will most definitely support them. It is their ICO, not ours. They can do. They can go do VC raise, or they can do an ICO, or go public on the Toronto Stock Exchange venture market. It doesn't matter. What does matter is that they have a real use case and a real client and real opportunity to focus on. But we are already hearing from companies saying, can I use Solve.Care platform as a foundation to launching my own care cards in the market and fund them through an ICO? And the answer is, talk to us. We'll see. And if this is something credible and we can get behind it, we will. The next question is from Solve.Care team internally about people who are meeting with prospects other than myself. So we are actually, I do need to lead most of the opportunities. Let's be honest and not say that there is a whole team out there that is today qualified to close the deal. However, when it comes to doing business development, we have a very strong team internally. And I'm very proud of the account management function that is developing the company, who do the follow-up, the CRM activity, who make sure that every prospect gets timely communication materials, that we are ready for the demo, we are ready with the right content for them. All those things are being and coordinated with the development team to ensure that we are presenting the latest version of the wallet, and all those things are being done by our internal account management team. We have more people being brought into that with different language skills, because I don't speak Japanese. We would need to have that because we are pursuing use cases in Japan. So we are expanding the account management team, but it's working really well. So the way it works is business development. A lot of the pipeline activity is driven by my Rolodex or the Rolodex of our board members, or the marketing activity of our team. Once a lead comes in and goes into the CRM system, then we have account managers who follow the leads. And we have account manager in UK. We have an account management team here in Kiev. We are adding account managers, I mentioned, in Far East Asia with Japanese and Korean language skills. So those account managers' job is to pursue the opportunity, ensure that we are tracking and following up. And then at the right time, I'm brought in, or Vadim is brought in, or both of us are brought in to come in and present and speak with the real domain expertise that we bring. And then again, the follow-up continues after that. Ultimately, over the next 90 days, the goal is to have more sales engineers who can relieve me from having to do all the meetings. But I'll be honest, I like this task. I enjoy the process of engaging with the prospects. They teach me as much as I teach them on what Solve.Care can do and should do. And every meeting I've done in the last last 6 weeks, and there have been many, I have walked out of the meeting more informed, more focused, more encouraged, optimistic, and clearer that what we are doing is the right thing. And I make subtle adjustments to the team and the product based on these meetings. So while this is an important function that requires more expansion, it also is a function that I must continue to do till we have reached a level of maturity where a team can take over. So my feeling is that till end of the year, we'll build out a much broader account management team. In the meanwhile, I must do what needs to be done and stay on top of this with the support of the account managers that we do have. How many users of the platform do we expect within 1 year? That's a great question. We do have some internal metrics and targets that we published. At the beginning of the year, we had said to ourselves, we want to have X 100,000 consumer wallets, Y 1,000 provider wallets. I don't have that number in front of me because we have revised it a few times. But ideally, we would have somewhere in the 250,000 to 1 million consumer wallets in the market by end of the year. Now, that's an aggressive goal, given we are halfway there. But at the same time, it's not an aggressive goal. If we look at consumer self-download, once we launch the Consumer Care wallet, that's a small number because that's not really a promoted wallet. It's just people downloading the wallet because they see value in it. I'm talking about promoted wallets. The number I put out there between 250,000 and 1 million is promoted wallets, meaning somebody's paying for that wallet to Solve.Care on a monthly basis. That wallet is a different wallet than, in terms of its importance to us, than the self-downloaded wallet from a consumer perspective. They're both important. They're both actually very important, but one requires a different kind of sales and marketing than the other. Now, on the consumer self-download wallet, we haven't established the metrics yet. We want to launch the wallet. We want to see how the first card response is. What are the cards that rise to the top as the most liked cards? And then we'll go from there. But the objective is that we want to have wallets measuring in the millions over the next, by end of 2019. Next question, how frequent will be the AMA session? So we had a lively conversation about this earlier today. My thought is that we should do an AMA at least once a quarter. So I'm willing to commit to that. And if we need to do it more often, we will. But at least have a regular on the road for those dates. So once a quarter is at least a reasonable cycle. But given the speed at which we're moving, we probably will have to we would like to keep you updated much more frequently. But an extended AMA once a quarter is a reasonable commitment. And if we need to do more, we'll do it more. Question from Kevin, will the advisors with ICO experience be helping to broaden crypto community awareness of Solve.Care? Talking about John, Nick, and Jenny here. So I think that's a great suggestion. All of them, John, Nick, and Jenny, are involved in multiple projects, but they have been very helpful to us, very helpful during the token sale process. We want to make sure that the advisor's role is clear and is rewarded properly for real results. So we will use them to expand our experience, our presence in the crypto space. And we are also bringing in advisors from the healthcare domain, like Mike Kessel, like Ted Was, who are really deeply experienced and entrenched in the healthcare delivery, administrative, or financial side, because they can really help us expand the adoption of the wallet in real serious opportunities at very large scale. So it's not just the crypto community I want to focus on. I want to focus on crypto and healthcare domain. But the answer in short is that all our advisors are reasonably engaged. Some are very engaged, and they're helping us tremendously in terms of opening and closing some large opportunities. So I expect that advisors will continue to be a part of our world, but we want to make sure that the advisor community has well-defined goals and well-defined targets. Otherwise, a lot of activity, a lot of noise, and no results is what happens. But that being said, yes, the advisory team will continue to expand if we see them giving us the ability to expand our product in the market. Jody is a little bit disappointed that he's not considered a Solve.Care advisor with crypto experience. Well, Jody is our community manager and does an amazing job of staying on top and ensuring that people have the information they need and demanding information from us. So I want to publicly thank the community management team, Jordi and Rudy and others, who are tireless in their support of the community and your questions. And they really have been significantly important in building and maintaining a large community. And for those of you who haven't noticed, perhaps, most companies see a significant drop-off in their community after the token sale. We have, in fact, continued to manage, maintain, and grow our community during and after the ICO. And I think the community will start growing even more so once we launch the Care Card user experience contest and other opportunities to make revenue from the platform. So thank you to the community members, community managers. They have done a great job of building our brand and our community so far. Last question is, how is the interest in the Care Card contest? My team's telling me to finish the AMA, but I will just answer the last question about the interest in Care Card contest. So, we will launch the Care Card contest tomorrow. We will gauge the interest from it. We have put forth very significant prize money in terms of first prize for each card is 100,000 CAN tokens. So we really do expect to see some high quality participants. And I'm after quality over quantity, but I think we'll see both. But we will learn from the first contest and see what we need to adjust for the next and the next, because this is not the only instance of the Care Card contest we will do. As I mentioned, we have dozens of cards that we want to challenge a global community of thinkers and out-of-the-box designers to come to us with ideas and to get rewarded for it. So long story short is, let's do the first one, learn from it, and then do the second one a heck of a lot better. But I think the first one will certainly give us a lot of usable ammunition. Finally, I want to thank the community. I think it's time to wrap up, but before I go, really appreciate the communication and the guidance and the support and the direct messages from many of you. And whenever you see something not going well or something not being clear, many of you reach out to me directly. I encourage you to do that. I apologize if it takes me a few days to get back to you. There is just a tremendous amount of work to be done. But I really do appreciate all the support from so many of you, from so many continents and time zones and backgrounds that have made Solve.Care the name and the company that it is. And we are at the very early stage of this journey, but it's already a pleasure, it has been a pleasure to work with my team, with the community. And I hope to make every one of you very proud of being part of this project. Thanks, everyone. Have a great day. Take care. Okay, let's go. How long was this, Tim? 10 hours?